Welcome to the Penthrox training video. Penthrox was introduced into EDMS in April 2016 and is available for doctor, paramedic, nurse, EMT and first aid use. The devices are contained in several of the packs that we use, and you'll recognise it because they're all contained in the actual Penthrox box. You will note the expiry date of the Penthrox is on the side of the box, easily telling you whether the device and the drug is in date. Now, the first thing you will take out of the box is the green device. It is commonly called in Australia the green whistle, and certainly you can find other videos available to illustrate that. But it is a green inhaler device. You will notice the components are the mouthpiece, which is on the end, that's the patient end, and this is the filling end, which is the opposite to the patient end. There is an activated carbon chamber, and the carbon is there to adsorb the exhaled Penthrox to make sure that it doesn't collect in an enclosed atmosphere such as a room or an ambulance. The expiry hole on there can be covered, giving a higher concentration of Penthrox to the patient, around 5%. You will then take out the bottle containing the Penthrox or the methoxyflurane, and again on the bottle you'll find an expiry date that you can check. The bottle comes sealed with a plastic seal that will need to be removed, and you can open the end of the cap by putting it in the end of the device and twisting it to loosen the cap. You then take the cap off of the bottle and you can then fill up the end of the inhaler. Now, the inhaler device should be held at 45 degrees, and you pour the methoxyflurane into the end of the inhaler, and while you are doing that you rotate the inhaler round a couple of times in order to make sure that the Penthrox is evenly distributed over the wick inside. If you look inside the end of the actual device, you will see the white fibre wick inside the inhaler. Once that's done, you can pass the device to the patient. Remember to tell them to take gentle breaths first because it can cause a cough initially. There is a wrist strap the patient can put around their wrist if they so wish. Once that's done, that can then be used as analgesia for the patient. The other important thing to remember is for all patients we give them the advice card, and the advice card contains the information necessary for the patient to be aware of. As this is a newly licensed drug in the UK, it will be subject to some audit, both nationally and also our own internal EDMS audit. If the device is no longer required, particularly if it's partially used, the device should be dunked into water or water flushed through it, placed in a plastic bag and put in a clinical waste bag. That concludes the video section of the Penthrox inhaler.